Vaginal discharge, vaginal infection. This is such a common problem which all of you females are facing. I am Dr. Nitika Sopti, and today I wanted to talk about a very specific but very important problem which is known as bacterial vaginosis. It's a vaginal infection wherein you have a discharge in the vagina and there are things which you need to understand about your vaginal health, because whether you need to treat it or not, whether you have it or not, what is the implication of having this vaginal infection, if you know about it, आपका mind silent रहेगा and आप बहुत ज़्यादा unnecessary worry भी नहीं करेंगे. Vagina has a lot of bacteria. If in this microbiome a few bacteria they overgrow, तो वो सारा balance bacteria का बिगड़ जाता है. And अगर bacteria का balance बिगड़ता है, उस केस में bacterial vaginosis की infection होती है. So how do we diagnose it? First and foremost, what are the symptoms you will have? It also leads on to a vaginal discharge which is creamy, greenish, grey, and the most characteristic feature जो इस discharge का है, it has a fishy odor. You will come to know about it, and it's very disturbing because बहुत सारे patients walk into my room and tell me, ma'am, I have a discharge which has a very peculiar smell and it's very irritating. That gives me a click. She can have this bacterial vaginosis. नाम बड़ा है, but it's not something which is very difficult. You know why? Because treatment is not required in 80 to 85% of women who have this bacterial vaginosis. Only if these symptoms are present, then only we need to treat it. So who should be treated and when should the treatment be done? First and foremost, diagnose करना बहुत ज़रूरी है before we treat it, and we diagnose it by taking a smear of that discharge and उसको slide में डाल के we send it to the lab to check for this bacteria which is chlamydia. आपको नाम से कोई मतलब नहीं. I'm just trying to tell you that when we do a regular pap smear screening, in that हम routinely check करते हैं, तभी हम आपको कहते हैं please get your regular pap smear which is cervical secretions का smear either annually or once every 2 years, because that will help us to reduce the risk of cancer of the mouth of uterus, that is cervical cancer, and will also tell us about these infections, because this bacterial vaginosis generally occurs in the reproductive age group 15 to 44 years. That is the age group which has this, and that is the reproductive age group. And the problems is bacterial vaginosis की infection से जो आपको होती है, they are generally during pregnancy, because while you are pregnant, if you develop it, you can have increased chances of preterm delivery and low birth weight baby, and वो तो हम definitely नहीं चाहते कि आपके हों. That is why a preconceptional visit is something which is very very important, जहाँ हम आपके सारे टेस्ट करते हैं, and we also take the cervical secretion smear to rule out all infections. How we treat it? We treat it using antibiotics, and वो antibiotics आपके डॉक्टर्स आपको definitely बताएंगे. Metronidazole, clindamycin, ये बहुत common antibiotics हैं. If you are pregnant, you will ask me, still can I treat it? Yes, of course, my dear. These are safe medications. Your doctor will give you the safer options, and we will definitely treat it, because it is very very important to treat if you have symptoms. Symptoms में you have a fishy odor and a greenish grayish discharge. That is a characteristic symptom. Another important point you want to ask, ma'am, is this a STD, sexually transmitted disease? It is not an STD, my dear, and your male partner will not have it. But yes, if you have sexual activity, chances of having bacterial vaginosis are high. It's very very important that you understand these facts. What are the risk factors for having this? Sexual activity is the major risk factor, and how can you prevent having it? Most important, understand the principles of vulval and vaginal hygiene. I keep talking in all my videos. Make sure that you are not douching your vagina. That's not healthy. Another important thing, make sure that the cleaning of the vagina is from front to back. The anal bacteria never come in the vaginal area. तो कभी भी आप use करते हैं, use a hand faucet. Never use those jets, because वो आपके सारे vaginal flora को, microbiome को disturb करते हैं, and it makes them more prone to develop this bacterial vaginosis. So very importantly, be very easy. It's not something which you can't treat. but it's very important for us to diagnose it. If you are having any vaginal discharge with a fishy odor, with some greenish grayish discharge, please do come visit us. You may confuse it with a yeast infection, which is a fungal infection. Of course, you need to treat it. If you have yeast infection, generally it causes curdy discharge with vaginal irritation, and in bacterial vaginosis, generally there is no vaginal irritation, but you cannot treat it with over-the-counter medications. You have to come for a checkup, and we have to make sure before we treat you for this. So make sure, come for your regular checkups to avoid having any such infections.